St. Luke's plastic surgery can help restore women both physically and emotionally after breast cancer.
When I heard the word cancer, I thought I was going to die. I thought my life was over. My story started on December 9th. I found out that I had HER2 positive breast cancer. The first step was I had my mammogram. I went to another hospital in the Valley. It was very unfortunate when I was at the other hospital that we weren't able to choose the doctors that we wanted to care for me. At that point, my husband did a lot of research to try to find the best doctors, the best facility for me to be treated, and that's where we came to St. Luke's. Once I met with Dr. Riley and we decided that I was going to go for the double mastectomy, he set me up with a plastic surgeon, Dr. Morrissey, which he is the best. My first appointment with him was on Christmas Eve. He took the time on a holiday to see me so that we could get the ball rolling.
I first met Michelle when she was diagnosed with breast cancer to discuss reconstruction options following mastectomy. So when we first saw her, we went through the different choices for reconstruction, and there are several. So we talked about all the different options, risks, complications, recovery.
The research that the doctors do at St. Luke's was amazing. They told me that they were going to cure me, and that was the best feeling then, but it was a struggle. It was very important for me to have the plastic surgery after my treatment was done with my chemo. I just wanted to be back to normal, be normal, look normal, so Morrissey made me get back to the way I was.
Patients need to be aware of how common breast cancer is, so they're by no means alone. They need to have an awareness that if they deem fit, the breast can be replaced. It tends to lend to a sense of wholeness, so to speak. So it's not for everyone, but we want the patients to be aware of what the options are and be able to make a choice that works for them.
It was just a wonderful experience, even going through something so hard and so difficult at the time.
Michelle has been a wonderful patient. She's been through a lot, from the initial diagnosis to the mastectomy and reconstruction and recovery. And at this point now, it's just a joy to see her. She's very happy, she's doing well, and she can do everything that she wants to do.
My husband and I ride bikes a lot, and he said, by the September, you will be back on your bike again. And he promised me that, and he got me back on my bike. I live every day to the fullest. I owe them my life.
Joining me in the studio is Dr. Lee Riley, an oncological surgeon and medical director of breast services at St. Luke's University Health Network. Dr. Riley, thanks for being here.
Thanks, Ashley, for having me.
So we saw in Michelle's story that she had already had surgery, but way before that, when she would come to a surgeon like yourself, tell me a little bit about the journey that she might have gone through.
Usually by the time I meet them, they know they have cancer. And then they have to go through this, so what do I do? And so as a surgeon, the first step is frequently surgery, usually surgery. And we sort of talk about the options of either having a lumpectomy with or without radiation therapy, or a mastectomy. And hopefully we can do the lumpectomy with radiation therapy, which gives you the same cure rate for most patients. But about 30% of people will need a mastectomy to get all of the cancer out for one reason or another.
Once they've had that surgery, depending on whether it was the lumpectomy or the mastectomy, what role does chemotherapy play, radiation therapy play, and how is it customized to each patient's cancer?
So it's a great question. So in the surgery is designed to get the cancer out and to try to figure out what's the chance that it might have spread. And it could have spread to the lymph nodes, or it could have spread to other parts of the body. So chemotherapy is typically used to treat it if a cell escaped. And we use that a lot because sometimes it might be a small cancer with a low chance of escaping, and a larger cancer might have a higher risk. So we usually give chemotherapy trying to prevent a cell from surviving if I didn't remove it all. Radiation therapy is sort of like in the middle of that, where maybe it's on its way to a lymph node and we didn't take the lymph tube out, so they radiate the breast and sometimes the axillary region, the armpit region.
How far has breast cancer treatment come, where it's no longer one treatment option or two treatment options for everybody, but really a very personalized approach?
Really far. So I was at a meeting this weekend up in New York, and there were like maybe 20 of us sitting in a room talking about some of the genomics, and they showed a slide of all kinds of cancers in stage and outcome 10 years ago and now. Huge difference in a single decade, and it's because of a lot of the technologies and a lot of the drugs. But radiation therapy has typically been 5 or 6 weeks. That's now there's a 3 to 4 week version of giving radiation therapy, same effectiveness. You can do it in 5 days, and we actually have a device where you can actually do it in the operating room while they're asleep, and they wake up and the radiation therapy is done. So that's helped a lot.
It is amazing, really unbelievable.
And you know, the people who have seen somebody go through 6 weeks of radiation therapy and then they can have it done while they're asleep, they get
life-changing. When you think about before a patient even comes to see you, how important are screening mammograms and being in touch with your doctor and in touch with your body into really the prevention of breast cancer in the first place?
So mammograms are hugely important. So we're trying to have conversations with our patients about what's the right screening for them and their options now. So if you're 60, you could get a mammogram every year, or you could get one every year. They're both valid, but it depends on what's your real risk, how often do you want to have a mammogram. There are a lot of factors that go into it. So it's really become a personalized screening. We try to give our patients, when they get a screening mammogram, what their risks are by different calculators. So that has changed things a lot. And it has made a big difference, because if we pick up a cancer earlier, our treatments are much more effective, and they need less therapy to be effective. So chemotherapy may be effective, but if you can get the same result without even getting chemotherapy, that's huge.
How much better is that?
Exactly.
Absolutely.
Yeah.
You know, you mentioned that by the time a patient comes to see you, they know that they have cancer, and they're really just on the beginning road of figuring out the process and how they're going to treat that cancer. Tell me what it feels like for you to work with a patient and to see them come out the other side healed.
It was great. So we used to make pendants for the women's 5K. So our patients wanted us to do that. So I saw somebody earlier today and got to give her like her 5-year pendant. You're a 5-year survivor, and you get the sense you're doing something meaningful.
This is great news for the women of the Lehigh Valley. Thank you so much, Dr. Riley. Appreciate it.
Thanks for having me, Ashley.
For more information on breast health at St. Luke's University Health Network, or anything from today's show, go to our website at thepeaktv.com. Thanks for joining us, and remember, every day is an opportunity to be your best self. This is The Peak.
Did you enjoy this video as much as we did? If so, give it a thumbs up and subscribe to our channel.